everyone, my name is Courtney Vaughn and I'm a veterinary technician here at All-Star Veterinary Clinic. Today I will be talking to you all about diabetes, what it is, clinical signs, insulin care, fun facts, and more. Let's jump into it. Diabetes is a condition that occurs when a dog's body can't regulate and or use glucose normally. This is due to a lack of insulin in the body. Insulin is the gatekeeper responsible for sending glucose into the cells where it can be used for energy. When there is no insulin being produced by the pancreas, the dog's blood glucose levels increase dramatically. In diabetes, the body tissues are starving due to glucose not being transported into the body's cells for energy. This causes the metabolism of muscle and fat to store energy, but even this is not effective and the body is left in a metabolic starvation. Most pets in the beginning phases of the disease are eating quite a bit of food. They believe they are experiencing starvation, but due to the rapid breakdown of tissue, they are losing copious amounts of weight. The clinical signs of diabetes include increased thirst, urination, weight loss, and appetite. Cataracts also can develop over time as glucose is pulled into the lens, which then pulls water, causing the white opaque color of the lens. Diabetes is diagnosed based on clinical signs, blood work, and urinalysis. The earlier we diagnose, the more successful we are at quickly managing the disease. Because dogs are insulin-dependent diabetics, once diagnosed, they do require lifelong treatment with injectable insulin. In addition to insulin, we often use food to help control glucose uptake throughout the day. It's very important when treating pets that they are on a schedule. We tend to be more successful in managing the side effects of diabetes if we can use insulin and meals twice a day, approximately 12 hours apart, to control sugar levels. Once insulin therapy has started, we typically recheck the patient by doing a blood glucose curve, 7 to 14 days from starting insulin therapy. The blood glucose curve will help determine if we need to make any kind of dose adjustments with the insulin. The main objective when treating diabetes is to resolve the clinical signs, prevent hypoglycemia, and improve the quality of life of both the pet and the owner. With that being said, there are several key points we should mention when using insulin therapy on your pet. Do not change your pet's insulin without consulting your veterinarian. Do not expose your pet's insulin to direct light or heat. If you think you administered insulin but aren't sure, don't repeat the dose. Wait until the next time your pet is due for insulin, then administer another dose. If your pet is receiving too much insulin, it will result in hypoglycemia. Hypoglycemia will present as seizures, excessive lethargy, wobbly gait, and anorexia. If you're concerned about any of the following symptoms, rub your pet's gums with Caro syrup or contact your veterinarian for further consultation. Insulin is a fragile substance that can be damaged by vigorous shaking. When preparing to use insulin, the bottle should be inverted, then gently rolled between your hands. Insulin can be stored in the refrigerator and used for up to 6 months, although we advise clients to monitor the bottle for any signs of discoloration. We tend to prescribe either U100 or U40 insulin. Depending on the type of insulin your pet is prescribed, they will need the appropriately sized insulin syringes to ensure they are receiving the proper dose. When finished with syringes, they can be disposed into a sharps container, which can typically be left at your veterinarian for disposal. Thank you for tuning into this video all about diabetes. If you enjoyed this video, be sure to leave a like and follow us on all social media channels. We'll see you next time.